An ever-increasing amount of digital data is becoming accessible to healthcare in almost real time. How can we use this data to provide timely responses to health crises? At the moment, this remains an unresolved challenge. Healthcare facilities are in fact unable to respond quickly to emergencies, as there is an information gap between when the crisis arises and when it is managed. COVID-19 has brought this critical issue out. Despite the contribution of computational epidemiology, which already in the early months of 2020 provided forecasts on the spread of infections, there was a lack of an equally efficient system to adapt data collection and analysis procedures to the speed of virus diffusion. The fragmentation of sources has led in parallel to the spread of an infodemic, which has caused uncertainties and delays in implementing effective and shared containment policies. The TrustAlert project is developed to respond to health crises promptly, giving professionals and healthcare facilities a tool for understanding and responding to emergencies. TrustAlert has three main objectives: intercept and understand the healthcare crisis by extracting reliable information from healthcare and clinical data and news. In this way, establishing a system allows us to anticipate potential future emergencies in real time and report alerts to healthcare facilities and political decision makers. Assess the impact by cross-referencing administrative health data, classifying population health, morbidity, and vulnerability status. This goal is essential to understand current healthcare needs, the spread of crisis, and to provide an informative basis for resource allocation and priority setting. Provide containment actions by conducting simulations to implement probabilistic scenarios that optimize the allocation of resources and allow evaluation of the impact of preventive measures. In this way, it is possible to provide real-time decision support, adapt the definition of scenarios, and plan cost-effective prevention policies for the emergency. TrustAlert uses integrative artificial intelligence composed of large language models for understanding and classification of the available digital information, symbolic models to translate the experience of healthcare professionals into knowledge for the algorithm, optimized and distributed computing structures for the execution of linguistic and symbolic models. Different types of data are used and integrated together. Healthcare data such as hospital discharge records, outpatient visits, emergency room visits, and information on hospital facilities. Current news and informative reports. TrustAlert respects the privacy of personal data by using algorithms and databases that comply with the General Data Protection Regulation, instructed by the European Commission. Furthermore, it implements the recommendations of the current Artificial Intelligence Act, issued by the European Commission, emphasizing the centrality of the individual in the design of the solution and documenting its operations.